Staphylococcus aureus is a gram-positive annual, antimicrobial resistant bacterial species present in the upper respiratory tract in about 30% of us. What is antimicrobial resistance? It is that bacteria have become resistant to the antibiotics designed to kill them. It stems from excess use of antibiotics in agriculture, which eventually spreads through poor hygiene. Predominantly, it is due to misuse of antibiotics. Mechanism of action. First, let's look at MRSA. Methicillin-resistant Staphylococcus aureus, penicillin-binding protein, is genetically altered to PBP2A coded by gene MECA, which does not bind to beta-lactam antibiotics, facilitating the resilience of the bacteria. VRSA, vancomycin-resistant Staphylococcus aureus, resistance is driven by alterations in binding affinity to peptidoglycan precursors. Other mechanisms include inhibiting cell wall protein, nucleic acid synthesis, and metabolic pathways. Transmission occurs by contact, and increased severity is seen in diabetes, skin infections, and IV infusions. There's a high risk of transmission through infected wounds in communities, exposure in hospitals, and through treatment procedures in healthcare facilities. Misuse of antibiotics in a surgical patient leads to complications in about 33% of people, among which 51% are antibiotic resistant. How to avoid antibiotic resistance? By completing antibiotic courses as prescribed, avoiding it for viral infections, and not sharing it with other people. Spreading awareness is the first step in protecting the community against vehement antimicrobial resistance until new drugs are available.